Measles is extremely contagious. A person needs only to breathe the air in a room where an infected person with the measles has been. Tiny water droplets that contain the virus attaches to a victim's airway lining and then multiplies, spreads, and instigates the disease. It is so contagious that one case is considered an outbreak. But it is preventable. Thanks to an effective vaccine received at 18 months, children are protected from measles. In the past 15 years, it has effectively been eliminated in the United States. But nonetheless, cases arise. In early April, a Holiday, Utah teenager was diagnosed with the first case of measles in Utah since 2005. He had reportedly contracted it while visiting Poland, and imported it to his high school, exposing hundreds of other students. Remember, one diagnosis is considered an outbreak.
We're obviously educational experts. We don't have a lot of expertise in health matters. We take our guidance and direction from the Salt Lake Valley Health Department.
That was the spokesperson for Granite School District, Ben Horsley, speaking on the measures taken by the school once the teenager was diagnosed.
They recognized one of our students had come down with the measles, who had not been immunized, and because the impact of that disease really only affected students who had not been immunized, they asked us to send home students who had not. So we were able to locate 22 students who had not been inoculated against this disease for various reasons and exempted them or excused them through April 25th.
As he said, it only affected those not immunized, and they weren't immunized for various reasons. For what reason would a person not be immunized? This is Dr. Horkley, a pediatrician working out of the Budge Clinic in Cache Valley.
I do have a few parents who have had family members have bad reactions. One of the families that I work with has chosen not to immunize their kids. Had various family members who have had seizures after having received the whooping cough vaccine, and so for that reason they just prefer not to have their child immunized. There are religious exemptions that people can have. I've had families worried that they just don't want to do them when the kids are that young.
I'm sorry, okay? I'm going to hurry real fast. Sorry, buddy. All done. No more.
Good job.
Okay, all done. You can pick them up.
What would you tell a parent who decides not to immunize their child?
I always try and be open-minded and try and find out where they're coming from. And then I just make sure that they are aware that these diseases are real and still out there. And then, if they still are hesitant, I always make sure that they know that the door is always open, that if they're, ever change their mind or decide that they want to do things a little bit differently, sometimes I try and come up with a compromise with them of maybe getting certain of the immunizations and not all of them. There are very few cases where I would actually recommend against doing the immunizations, just because in general they are so safe now.
Paula Murray, a patient of Dr. Horkley, has chosen not to immunize all of her children. She felt it unnecessary for her fourth.
I did not take the time to even consider what the risks were. I went into my doctor, he said, immunize your kids, and I said, okay, so I did. But by taking time to read about them and understand what immunizations actually do, I was totally equipped to make a better decision about whether to have my children immunized.
Do you think the immunizations are necessary?
I do. In certain circumstances, absolutely. Especially in countries where the control of the disease is almost impossible. But there are the consequences from the immunizations also. I mean, you can stop the spread of one disease, but, you can cause other problems.
In the meantime, the initially quarantined students at Olympus High have returned to their classes, and the Salt Lake Valley Health Department continues to investigate possible infections. 5 cases of measles were confirmed from the outbreak, and 1 is still probable. Reporting for Utah Public Radio, this is Jesse Dredge.